for being with us today. Welcome to the fifth and final seminar in our 2025 Rooted Seminar Series. We're thrilled that you're here with us today as we talk about affirming oral health care models for LGBTQIA plus patients with Dr. Alex Barrera. I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health. I'll be kicking us off and walking us through some housekeeping and starting pieces. I have Shayla Stewart, my colleague, here with me from AIDPH. If you have any questions, comments, please post them in the chat. If you're having any tech issues, Shayla can help you out if you need any Zoom advice. And after I get us through our introduction, I will be handing it off to Dr. Alex Barrera, who's here with us as well. Okay, so we're going to go ahead and get started. We want to take a moment and say thank you to our partners who work with us on our Rural Oral Health Seminar Series, our Rooted Seminar Series. You will see these organizations cited and supported throughout the content in this seminar series. Today, we are going to start again with a welcome and some housekeeping, giving us some information to start us off about intersectionality among rural communities and LGBTQIA plus patients. And then again, our didactic presentation is from Dr. Alex Barrera, looking at affirming oral health models. And we will, of course, have time for questions at the end. If there are questions that occur to you or pieces you want to share throughout, please post those in the chat and we will make sure we get to those. This session is being recorded. All of the session materials, the slides, the recording, the links that we share will be posted on our Academy space after the session. We ask you to connect with your colleagues here on this call by introducing yourself in the chat with your name. If you want to share your contact information, your organization, that would be great. Again, if you have questions throughout, you can post that in the chat. We also want to make sure we stay engaged and we hear from you. We invite you to be on camera during this session. And again, share your questions and comments throughout. A little bit about AIDPH. We are a 501c3 nonprofit. Our mission is to empower our community to advance oral health through science, education, and advocacy. We're pulling those three together in our seminar here today. We do this work because we have a vision of a justice-oriented oral health system. Our organization has 4 communities of focus. That includes LGBTQIA plus people, veterans, people with disabilities, and people living in rural communities. Part of what we do to advance our mission is preparing the workforce, all of you, to serve marginalized and underserved communities. It's important to note as we talk about our communities of focus that all of our communities of focus have a common experience of historical exclusion and marginalization from healthcare systems. And amongst our 4 communities of focus, there is, of course, intersectionality. For example, this seminar series is focusing on rural oral health, and today we are talking about LGBTQIA plus people and how we can implement affirming care models to better serve them. An estimated 2.9 to 3.8 million LGBTQIA plus people live in rural communities, and between 3 to 5 million queer people have a disability. As we talk about the data and oral health outcomes of these communities today, you will see that intersectionality can incrementally increase barriers in access to care, and why the best practices that Dr. Barrera will be sharing with us are so important in addressing those barriers. Okay. This is a brief overview of the AIDPH Academy. I mentioned this previously. This is our online digital learning space. There is CEU attached to the seminar, as there are most of our seminars. And this is a space where you will get that. We will include instructions on how to get your CEU after the seminar. And also you will be able to review past seminars if you weren't a live participant in them. And there will be information on how you can complete all 5 of this year's series to earn a certificate. These are the norms that we share as we come together in a space to learn from each other and share, to ensure that we come together respectfully and safely as we approach this learning experience here today. We use first names to facilitate equality in the discussion. We invite you to add your pronouns to your Zoom name, ask you to introduce yourself. Again, we talked about that in the chat, and invite you to be on video as we are here together over the next hour today. Okay, this is an overview of the series. Again, this is our fifth and final seminar of 2025. Post-seminar, we will share out information on the steps to take in earning a certificate in advancing oral health justice in rural communities. If you are watching this seminar asynchronously, you are already in the Academy space and will find instructions on how to complete the 2025 Rooted Certificate in the course materials section. And as you keep an eye out on those materials coming out post-session, please also keep an eye out for upcoming planned 2026 sessions of this seminar series. Our presenters, I will be giving us some brief interviews, so myself and Dr. Barrera do not have any disclosures to share. Since our Rooted seminar series is grounded in examining rural communities and opportunities to advance oral health in those communities, I want to take a moment before we hand it over to Dr. Barrera to look at the intersectionality of rurality and LGBTQIA plus people and how living in a rural community can compound health and healthcare access disparities that LGBTQIA plus people are already facing, so we can consider those disparities and how the best practices and frameworks we are going to hear about will be shared can help us address those barriers. So looking at rural communities, I think everyone on this call, I know many folks are participants from our past seminars. So you understand that looking at rural communities, rurality on its own carries a significant set of health and access challenges. Rural residents experience higher rates of chronic disease, including a 19% higher risk of heart disease. We also see a 2% higher prevalence of diabetes, and rural communities face disproportionately worse outcomes related to anxiety, depression, and other chronic mental health conditions. On top of that, rural residents die from stroke at an 8% higher rate, and oral health outcomes follow that same trend. Rural communities have higher rates of gum disease, tooth decay, and indentulism, while also being less likely to have dental insurance or regular dental appointments. And when we think about LGBTQIA plus people living in these same rural communities, these existing disparities don't just add together, they compound. So this next slide takes us into what that intersection looks like. It's important to acknowledge that very little data exists on the oral health and well-being of queer people. What we do know comes largely from small studies and from emerging research, including some research from AIDPH that we'll share links to at the end of this seminar. Our findings show that transgender people see the dentist less often than cisgender people, signaling gaps in both access and comfort with care. And compounding this, dental schools largely do not include LGBTQIA plus populations in their curriculum, meaning many new clinicians enter the workforce without training in culturally responsive affirming care, which is why participants participating in sessions like this and hearing from Alex is so important. So again, thank you for being here, and we encourage you to share out the recording and the asynchronous materials afterwards with your colleagues. And while the oral health data are limited, we do have stronger insights into general health outcomes for rural LGBTQIA plus youth, which brings us to the next slide I'll share. While we recognize, again, there's a significant data gap around the oral health needs of queer people, we have clearer findings on the broader health and well-being of rural LGBTQIA plus people. This graph is from the Trevor Project, and I think Shayla is going to pop it in the chat. And it's linked here at the bottom. It's highlighting access to supportive spaces at home, in school, and in the community. What we consistently see is that rural LGBTQIA plus youth report far lower levels of support across all settings when compared to non-rural LGBTQIA plus youth. Supportive environments are a core protective factor for mental health, help-seeking behavior, and overall well-being. So this reduces access to affirming spaces. it becomes an important backdrop when thinking about how LGBTQIA plus people navigate any form of care, including oral health care. This second graph shows a related pattern. Higher levels of victimization among rural LGBTQIA plus youth. Rates of bullying, harassment, and threats of violence are all elevated compared with their non-rural peers. And these experiences contribute directly to chronic stress, anxiety, and disengagement from systems, including health systems. So, as we consider oral health access today, this context helps explain why LGBTQIA plus people in rural areas may face deeper barriers and require more intentional affirming care models. And finally, looking at these points here, rural healthcare shortages are well documented. Fewer providers overall, and disproportionately fewer clinicians who are trained, experienced with LGBTQIA plus health, which means even where care exists, it may not be affirming or accessible. Because social networks in rural areas tend to be smaller, more interconnected, and less anonymous, stigma or lack of community acceptance can create isolation and discourage disclosure of identity, which in turn reduces likelihood of seeking or obtaining appropriate care. So we're going to shift here from understanding why rural LGBTQIA plus populations face compounded disparities into how we design care models that meet their needs, especially in oral health settings. And that's why I'm so excited to pass it over to Dr. Barrera. Dr. Alex Barrera is the Director of Dentistry at Avenue 360 Health and Wellness, a federally qualified health center in Houston, Texas. Dr. Barrera founded the Houston Equality Dental Network in 2019 and now aims to bring better education and understanding about the LGBTQ plus community to the profession of dentistry. Alex, I will hand it over to you now. I know you're going to pull up your slides, so I'll stop my share. And I also welcome you to further introduce yourself and share about your background as you wish. And thank you for being with us here today.
Of course, thank you for having me. Hello, everyone. Good afternoon. I am Dr. Alex Barrera, and I'm a general dentist based out of Houston, Texas. So really excited to be here today. I'm going to go ahead and share my slides. So just 1 second here. So Liz, can you confirm if you can see that okay?
Yep, that looks
Yes.
great.
Okay. Excellent. Perfect. Alrighty, so feel free to pop in the chat if you have any questions that pop up. Again, so I'm the Director of Dentistry at Avenue 360 Health and Wellness. We are a federally qualified health center based in Houston. We have several locations around the city, but our one and only dental location is in the Midtown area of Houston, so really close to downtown. A very urban place. We get a lot of our patient population varies quite a bit. And so something I always start these talks with is why now? Why is this an important issue to cover and to learn about in 2025? And I will often get the question that, this is something that we didn't talk about 10 years ago, 15 years ago, 20 years ago. But in reality, this is something that queerness has been with us since the beginning of life itself. And something I always like to share is that there is so much evidence and so much science and biology behind the sexual and gender diversity that already exists in nature. And we see this by thousands and thousands of different species that show things like changing in gender throughout their lifespan that show same-sex relationships and copulation in different species. And so this is something that's known to be true based on biology. We know that the natural world is full of this gender diversity. And we also see this, of course, in the plant world, right? There are thousands of species of plants that show gender fluidity as well. And so I start my presentation with this because it's important to know that there is a difference when the human lens starts to see gender and sex, because humans are the ones that have created this cultural construct that differentiates between sex and gender. But the truth is, just like in plants and animals, gender, sex, sexuality varies enormously within humans as well. And we can see this again through our biology by something that we will call differences in sex development. You might have heard of the term intersex before. And if you're unfamiliar, differences in sex development is a group of rare conditions involving someone's genes, hormones, and or reproductive organs and genitals that pretty much gives someone their sexual development that is different than what is expected. And we formerly known this as intersex. And it says that it means that someone's development, whether physical or internal, is different to most other people's. And this is based on biology. This is based on someone's chromosome makeup, right? So we know that in biology, there are these differences, there are these variances. And we see this in cultures from the past. Since the beginning of recorded human history, there have been thousands of cultures all around the world in every continent that has shown gender fluidity and sexual fluidity. So many non-Western traditions in Asia, in North and South America, that have had thriving communities and thriving populations that not only accepted and tolerated queer people, but also revered them and held them to, to different standards and to that these were people that held very specific and special places within their communities. And we see this, for example, with the Muche people of Mexico, which was a recognized third gender among the Zapotec people in Oaxaca, Mexico. We see this as well with the Hirja, which is a previously recognized third gender for many, many South Asian nations. And for a long time, this was a third gender that was legally recognized that would occupy a space in the region's ancient religious traditions. And these were people that were honored and celebrated by their communities. So, shifting gears a little bit, we do know that the reason that why we're here, the reason that we need to speak about queer people in the terms in and their disparities is because these disparities exist. So why do these exist, and what's the current state of these queer disparities when it comes to oral health? So the reason that these disparities exist first and foremost is because of the concept of heteronormativity. It's the assumption that everyone is heterosexual, and it's this assumption that gender roles and stereotypes are very specific. This ends up leading to invisibility and stigma of other sexualities and other ways of being. And this heteronormativity that we have is the root cause of that homophobia. Homophobia, in turn, leads to healthcare disparities in the queer population. So in 2016, the community was identified as a health disparity population by the National Institute on Minority Health. And this was because, we're recognizing patterns that this population had less access to healthcare, higher burdens of certain diseases, and very special and unique health challenges. And just like Liz stated, back in 2016, they also emphasized the need for research in this community. And still to this day, there's a big lack of research when it comes to not only the oral health disparities, but just health disparities as a whole for this community. In 2020, a survey conducted by the Center for American Progress found that about a quarter of LGBTQ people reported experiencing some sort of discrimination throughout their lifetime. About 1 in 10 queer people reported providers refusing to see them based on their orientation. 3 in 10 transgender individuals reported providers refusing to see them based on their gender identity. And about a third of trans people reported hearing negative comments about them at a healthcare facility. So close to 70% of queer people have reported that discrimination somewhat negatively affects their well-being. Oops, let's see. Sorry about that. I'm going backwards. Okay, and then so what we know to be true with LGBTQIA youth is that these individuals are showing elevated rates of things like suicide ideation, signs of depression, anxiety, higher rates of alcohol, tobacco, marijuana use, and polysubstance abuse in queer youth. And something to know is that, and something to acknowledge is that, young people are really aware of feeling different at a very young age. So young queer people specifically start to become hyper aware of how the world sees them and how the world treats them. And sadly, we're seeing higher and higher rates of mental health issues as early as ages of 10. We're seeing substance abuse issues as early as age 12 when it comes to queer youth. In this survey, we're questioning fears and concerns about accessing healthcare between LGBT people, or I'm sorry, LGB people and transgender individuals versus those living with HIV. And we see in this chart, with all the different questions, I will be refused medical services or people being afraid that they'll be treated differently because of their identity. Those that were transgender face a much higher rate of these fears of being discriminated against and stigmatized, and also fear that there's not enough education or not enough support out there for these people. And much like Liz mentioned, is that all of these different components that make up someone's identity lead us to the minority stress theory. So this just describes that high levels of stress faced by members of multiple stigmatized or marginalized minority groups can all add together and compound together. So those holding multiple marginalized identities will experience a much greater rate of discrimination. And we see that specifically with this population, with transgender women of color. Trans women of color are currently the most targeted subgroup in this country. They have multiple marginalized identities, right? They face transphobia, homophobia, sexism, racism, colorism. And so when someone is a part of so many different minority groups, these all compound together to make it very, very difficult for them to live happy, normal, and healthy lives. So when it comes to the queer community, we understand that they face much, much higher burdens of behavioral, medical, sexual, and social political outcomes. And we have found that queer people living in areas with high prejudice or areas with high anti-LGBTQ laws will have been shown to die sooner, around 12 years sooner on average than those living in more accepting communities. So I'm going to briefly touch on a couple of topics that affect this community, starting with HIV. So currently, about 1.1 million Americans are living with HIV in this country, and out of those 1.1 million individuals, about 14% are unaware of their infection. In 2022, over 38,000 people received an HIV diagnosis in the United States, and a majority of that was through male-to-male sexual contact. But some of that was through heterosexual contact or injected drug use as well. And from 2018 through 2022, there was about a 12% decrease in new HIV infections in this country. And currently, men and transgender women who have sex with men are the population most affected by HIV in the United States. And like I said previously, while there has been an overall decrease in new infections, the number of HIV infections for specifically transgender adults and adolescents is increasing. And the CDC recommends that all adults, regardless of your demographics or sexual orientation or lifestyle, all adults should be tested for HIV at least once within their life. And as some of you may know, has been a lot of progress in the evolution of HIV treatment, right? This started as a handful of pills several times a day to one pill a day to now an injected drug that's administered monthly to take care of someone's and control someone's HIV. So now living with HIV is very manageable, especially with proper care and treatment. In 2022, about 76% of those living with HIV were receiving some HIV care, while about half were retained in care, and 65% were virally suppressed or what we call undetectable. And when it comes to HIV treatment, being virally suppressed or undetectable is the goal. This is because having a suppressed or undetectable viral load will protect that person's health, but it's also going to help prevent disease progression. So there is a major prevention benefit in HIV treatment. We may be familiar with what we call PrEP or pre-exposure prophylaxis. Every medical provider should be very familiar with this. PrEP is a medicine that people who are at risk from taking HIV take to prevent getting HIV from either sex or injected drug use. And there are currently two medications approved for PrEP. We have Truvada and Descovy. So if you see this in a patient's medical history, it's important that you know what these drugs are and why your patient is taking them. PrEP reduces the risk of getting HIV from sex by 99% when taken as prescribed. So there is a huge prevention aspect with PrEP. So now bringing it closer to oral health. So about 60 to 80% of HIV positive adults will have what are referred to as an HIV related oral abnormality. So that could be anything from dry mouth or xerostomia to mouth ulcers, leukoplakia, candidiasis, oral warts, periodontitis. This is because those living with HIV have a much weaker immune system and are much more susceptible to these opportunistic infections. And so those living with HIV can and should have regular dental visits. So in dentistry, we take standard precautions with all patients, regardless of their HIV status. So something that a lot of dentists, a lot of dental workers fear is an occupational risk when it comes to injuring themselves with potentially someone that could be infected with HIV. And it's important to understand that, for example, after a needle stick exposure to HIV infected blood, the average risk of HIV transmission is really low. It's about 0.3% per exposure. And this is with someone or with HIV infected blood. But still, I get the question, what if? People are concerned, people are scared. And as a dental provider, it's important to learn and understand that if there is an exposure that may occur, we have our antiretroviral drugs, or just like we have PrEP, we also have PEP, or post-exposure prophylaxis. And PEP is to be taken within the first 72 hours of exposure to help prevent HIV transmission. And it's really important to learn and know and understand that within the past 25 years, the Association of Dental Safety has reported that there have been zero reported cases of seroconversion in the dental setting. So what that means is that despite any potential needle stick injuries, have been zero cases of someone transmitting HIV to a healthcare worker within the dental setting. So I'm going to briefly go over HPV and cancer and how that relates to this community. So queer people have higher rates of HPV. About an estimated 61% of HIV negative and 93% of HIV positive gay and bisexual men have anal HPV infections. So this is compared to about 50% or even less of heterosexual men. In 2023, there was a study through JADA that found that 1/3 of adults understand that HPV plays a role in oropharyngeal cancers. So that same study showed that more than half of adults believe that the dentist had a responsibility of discussing HPV vaccination with their patients. So as an oral healthcare providers, we should be having this conversation. And we should understand that queer people have a much higher rate of HPV, therefore have a higher risk of getting oropharyngeal cancers within their lifetime. Okay, so moving on, why is there a focus and why should there be a focus when it comes to the LGBTQ population and dentistry? Well, the truth is that dentistry has roots in a very conservative nature of this profession. Dentistry is often seen as left behind when compared to medicine. Um, it's often seen as less important than medical care. And what we found is that queer patients will do more shopping around for a dentist than they do for a medical provider. So that means as dental providers, we want to be culturally affirming and culturally competent to see these patients who are actively seeking us out. So some data on LGBTQ inequalities, just specifically in oral health care. So queer individuals are about 77% more likely to experience discrimination weekly. Queer individuals were about 31% more likely to say that their recent dental visit was 2 years ago or more. So they're having less frequent dental visits. Queer individuals identifying were about 77% more likely to report that they have visited an emergency department for dental care. So this means that maybe queer individuals don't have a regular dental home or dental office, so they're being forced to visit an emergency room due to dental pain. Compared to non-LGBTQ individuals, those identifying as queer were about half more likely to say that they felt self-conscious or embarrassed because of their teeth or mouth. They were also about half more likely to report having high levels of anxiety when it comes to receiving dental care. So queer people are more self-conscious. Maybe it's because they haven't seen a dentist in the past. Maybe it's because they don't have a regular dental home. Maybe it's because they're more aware about their needs. Maybe it's because they have more anxiety and fear about visiting the dentist, so they're worried that they have more problems than they actually do. Um, but about LGBTQ people stated that they were about close to 60% more likely to report that it would be extremely, very, or moderately difficult for them to get care from a dentist. So queer people are scared to go to the dentist. They are more self-conscious about their teeth and mouth, and it's also more difficult for them to obtain access to care. So the dental profession holds a very special space of trust within society. And by becoming a healthcare provider, we make this ethical commitment to treat all patients with compassion and understanding, regardless of who they come from, what they look like, and in this case, who they love. So supporting the queer community, it gives us this special opportunity to, not only combat these healthcare inequalities, but to potentially also save someone's life. Because especially in rural places, if a queer individual can come to a dentist that is affirming, that is educated, that is understanding, that uses their preferred pronouns, that uses their correct name, this can often save someone's life. This can often show that is someone out there, especially someone in a healthcare role that is affirming, that understands them. So, I'm going to briefly talk about what it means to be transgender and how we can better serve this community as a healthcare provider. So, about 1.4 million transgender adults live in the US today, and one is considered transgender when their sex assigned at birth does not align with one's inner sense of their gender. And there's a difference between gender identity versus gender expression. So, a transgender identity is not necessarily dependent on someone's physical appearance or not dependent on any medical procedures they may or may not get. Many transgender patients will be prescribed hormones to align their bodies with their gender identity. And yes, many will undergo surgery. But things like hormones or surgery are not part of every transgender person's experience. It is very, very difficult to obtain affirming care. It is very expensive to find affirming care for transgender people. And so because of that, it's important to also understand that, a gender non-conforming individual may present with aspects of both stereotypical gender identities. For example, a beard while wearing high heels. Someone may also choose to present more androgynously as well. So like I mentioned before, transitioning, it's that process of a transgender person changing aspects of themselves like their appearance, their name, their pronouns, or even making physical changes to their body so that they feel more congruent with the gender they know themselves to be. And transition can vary very widely. It can vary, only on someone's physical appearance or the way that they dress. It may vary in their name or their pronouns if someone chooses to change their name or not. And medical transitioning can vary widely as well, whether someone chooses to take hormones or hormone blockers, whether someone chooses to have any surgeries. And then in dental cosmetics as well. Dental cosmetics will play a role in some transgender individuals' transitioning experience. And again, a person does not need a certain medical procedure or a certain surgery to validate their existence. So again, gender identity and gender expression are two very different things. So if a transgender person states that they are transgender, or states what their gender is, we believe them, we understand them, and we don't force them to prove or to validate their gender identity based on a certain surgery or procedure. Some special considerations for transitioning. Transitioning is difficult for people. They first have to have self-acceptance and be prepared for this big life change. But they also have to play into consideration the acceptance of others, their social or religious acceptance, depending where they come from. If they are in a more rural society or place, it may be a lot more challenging for them to transition because they may not have support around them. They will have to be prepared to lose people in their life. There's a fear of explaining yourself to others, a fear of dating, a fear of meeting new people, a fear of your job um, and your workspace, experiencing your transition as well. And of course, financial considerations. Transitioning is extremely expensive. Not many people can afford to see an affirming doctor, or to change their whole wardrobe, to go through medication or surgeries to feel more like themselves. And it's difficult, especially for those in rural places, to find the right healthcare provider. And so a big topic is this idea, this concept of surgical regret. And I find this really interesting because there was a study in 2021 that polled almost 8,000 transgender patients who underwent any type of gender affirming care or gender affirming surgery. And this showed that those transgender individuals who underwent a surgery showed that their regret after this gender affirming surgery was less than 1%. So less than 1% of these individuals regretted the surgery or the decision that they made. And this is really interesting because if you compare this to other surgical procedures, for example, those who have had breast reconstruction or breast augmentation, for breast reconstruction, the rate of regret can go up to 47%. For things like body contouring procedures, there's a rate of regret from about 10 up to 33%. There's a rate of regret for bariatric surgery or getting a tattoo that's anywhere from, close to 20%. But when it comes to gender affirming surgery, the rate of regret is essentially non-existent, less than 1%. So this shows that gender affirming procedures, gender affirming care is life-saving. So when it comes to seeing a patient in real time in your dental setting or in your clinic, a couple of things to keep in mind. When it comes to patient intake, we want to avoid dead naming someone, meaning that we use someone's previous name before they transitioned. So we have their legal name versus their correct name. And sometimes for insurance purposes, we need to keep that legal name. We need to use that legal name. However, we don't need to acknowledge that patient with their dead name. We can use their correct name. And we do this in a way by asking the patient, in terms of our patient intake forms, what is your correct name? Is there another name that you wish to go by? Having space like pronouns for someone to input their pronouns whether it's in your electronic health record or a form that they may fill out, it's always okay to ask someone what their pronouns are. It's also always okay to use gender neutral pronouns like they, them. So this is just a little example of, what you may find in a patient intake form. So can you audit your records and your forms to make sure that you have more gender choices than just male or female? Can you have a non-binary option or maybe an empty space in your form? Can you even have the option to allow someone to not disclose their gender if they wish? And also have patients use their correct name, but also acknowledge and use that correct name. Have options for pronouns in your forms, like we said before. And maybe you have something like this. This is from a previous EHR that I used to have in my clinic. It's what we call care alert warning. So even though we had a patient's legal name in their chart um, for grant purposes and insurance purposes, we would have these pop-ups that pop up that will tell us, please refer to this person as blank, and these are the pronouns that you want to use. So this is the pop-up that opens up every time we open the patient's chart. We currently use Epic for our EHR records, and it's kind of the same thing. We have our flag that will pop up as well, so that we are sure to acknowledge the patient with their correct name and correct pronouns. So practice by using gender inclusive words like people, person, kid. You can do this with your patients. You never want to assume that someone, if you see a wedding ring on someone's finger, you never want to assume that that male person has a wife, right? You can say spouse if you're unsure and asking about their life or trying to be friendly and get to know them. Same thing with their children, right? You don't want to assume their children's gender, and you can say something like your child, your kid. And so it's a good tool and a good exercise to practice these gender inclusive words. And we don't assume that we know someone's name or someone's pronouns or how someone identifies solely based on their physical appearance. It's always okay to use the singular pronoun they as this default pronoun. And it's always okay to use a person's name if you don't know their pronoun. So practice doing these sort of exercises. And if someone shares their pronouns with you, make sure you use them. Make sure to remember them, put them in their chart. So when it comes to the dental setting, there are things that we need to know as dental clinicians, but there's also things that I don't quite need to know. And when it comes to someone who may be transgender, something I like to do is always ask, is there anything else you'd like us to know about your transition to make your dental care more comfortable for you? We need to know about medical surgery or about surgeries. We need to know about medical history. We need to know about the medications that my patient is taking. But if there's something that does not pertain to my care for them, it's important that we don't pry and that we don't make someone feel uncomfortable as well. So in practice, much like Liz said in the beginning, there is such a huge lack of research when it comes to queer oral health specifically. And so a lot of what we know is really just due through our experience. And so this information on this slide, I actually got from a mentor of mine, Dr. Ann Koch. She's a transgender endodontist that transitioned later in life when she had a very long and fulfilling career in endodontics. And so this is some advice that she gave me through a phone call years ago, is that she's found that trans men have an increased susceptibility to plaque, gingivitis, and periodontitis or gum disease. Transgender individuals also have a much higher rate of xerostomia and are much more likely to use tobacco. While for transgender women, on the other hand, we may notice that estrogen might affect and cause TMJ issues, and a combination of estrogen and progesterone can lead to an increased plaque sensitivity as well. So what needs to change? So this was a screenshot from 2023 from the ACLU website. And at the time when I took the screenshot, they were tracking 321 anti-LGBTQ bills in the United States. And Fast forward to a year, this was in 2024, that increased tremendously. In 2024, the ACLU was then tracking 533 anti-LGBTQ laws. So, of course, out of curiosity, I checked recently, and the scary thing is that this is continuing to increase. In 2025, currently, the ACLU is tracking 616 anti-LGBTQ bills in the United States. And so these are laws aimed to discriminate against LGBTQ and queer people, laws to make it harder for transgender individuals to receive affirming care, laws making it harder for LGBTQ youth to find support. And unfortunately, this is causing people in rural places to do things like not come out, to unfortunately maybe take their own lives, or if they're able to move away to more affirming cities. So improving as a profession, right? So we want to improve as a profession by increasing our awareness and education amongst our profession, amongst our community. And we do this by taking CE courses, much like you're doing here today, by taking webinars. If you are maybe a leader in an organization and it's your duty to kind of bring presenters and topics, how can you bring presenters and topics that are specific to LGBTQ health or LGBTQ disparities to your organization, to your dental school? We also need to create a safe space for queer people. So we want to include queer individuals to our profession. So a lot of organizations will have diversity or inclusion committees, but how can we include queer people to these DEI committees? How can we make sure that we have a queer person or a transgender person in our organization, on our board? How can we diversify our hiring and admissions process, whether you're part of a health center, an organization, a school? How can we diversify that board that oversees hiring and admissions? And can you have a non-discrimination clause in your workspace or in your school that specifically states you do not discriminate against LGBTQIA plus individuals? And lastly, how can we better diversify our profession by letting queer youth and LGBTQ youth know that dentistry is a space where they are needed and wanted? How can we include our queer youth in pipeline programs and student success programs to help these individuals, especially those from rural places, continue their education and maybe progress in an education in dentistry as a career? And this is talking back to what Liz had mentioned. We created the Houston Equality Dental Network a few years ago, and this was a network of LGBTQIA dentists in Houston that provided affirming care, that understood how to speak to parents that had queer children, that understood how to treat someone who was transitioning, to understand what it means to work with someone who is at risk. And so we had have a network, an online directory where queer people around the city can look for a dentist around their area that is in our network, that is affirming and that has the cultural competency to treat them. And through the Houston Equality Dental Network, we are a social network. We share this idea and this philosophy of wanting to diversify the profession of dentistry while also bringing education and awareness to the greater dental community. And these are just some pictures from events in the past, presentations at the dental school, working with one of our community, or actually a couple of our community partners there in the top. It's one of our visits to the Law Harrington Community Health Center. That is a nursing facility here in our community that is specifically for LGBTQ elders. It's a housing facility. It is the largest specific LGBTQ specific housing facility in Texas. There in the bottom, we have a Pride Pantry. So it is local nonprofit organization that collects food items for queer people who are food insecure. And of course, we have our social events around as well. And that is our students group in the dental school, the UT School of Dentistry at Houston. Okay, so how can you improve individually? Well, first and foremost, you always want to surround yourself with people who live different lives as you. Ask yourself questions, challenge yourself, and be vocal and challenge the norm. What I tell people, especially someone who may be heterosexual and straight and not in the queer space, it's important to be mindful of your privilege, but to also use that privilege for good, to be vocal, to stand up for someone if you hear a rude or disrespectful comment. Be that person, be that change. And finally, 5 steps to become a better ally for this community. Number one, educate yourself. And we do so in ways that you're doing now. Learn about the community, learn about health disparities, learn about health outcomes. Avoid assumptions. Never assume someone's pronouns or gender. Never assume someone's um, ability to understand their oral health and their connection between their identity and their oral health. Number three, be visible as an ally. So what that means, if you have an office, maybe celebrate things like Pride, celebrate LGBTQ History Month. If you are a dental practice owner, can you do some sort of event? Can you celebrate via social media, when it comes to Pride Month to show that you are an affirming provider? Also, another way to be visible as an ally is to use your pronouns and to use them publicly. Use your pronouns when you are on a webinar. Use your pronouns in your email signature, in your ID or business cards. Next, create an inclusive environment. So diversify your workforce, diversify the people that you interact with. Um, See how you can maybe work with a local queer organization, and allow that to be part of your regular routine. And finally, don't minimize our queerness. All right. I often say that sometimes I'm told pretty frequently or was told in the past, wow, I wouldn't expect that you were gay. Or I didn't know that you were gay. And sometimes some people use that as a way of as a compliment, but to me that doesn't really seem like a compliment. That tells me that you're trying to minimize who I am, or you feel like my queerness is better left unspoken. So don't minimize someone's queerness. Sometimes things may make you feel uncomfortable, but it's that sensation of stepping out of your comfort zone that allows us to grow as a society and allows queer people to be seen and visible and progress in life. Alrighty, so thank you. I'm going to transfer it back over to Liz here to finish up.
Thank you so much, Alex. That was wonderful. I'm going to pull up some slides here to talk us through next steps, but does anyone have any questions for Alex before I do that?
I have also put my email address in the chat up there in the top, so feel free to reach out to me if you have any questions at all.
Okay, fantastic. I'm wondering, Alex, if folks want to take a look at the Houston Equality Network and are thinking through ways that they could implement something similar in their own communities, or with their coalition. Where should they go? What should they look at, to kind of model your example?
Yeah, so I know that there are other cities that have been trying to do the same, have a similar organization. I know there's a group in DC, and a group in Dallas, Texas as well now. Right now, our website is under construction, so it's not available at the moment. So the best way to connect with me would be through my email. And if you're looking for some sort of society or community like that in your area, I can work with my network and help you get you connected.
Okay, fantastic. Thank you. I'm going to pull up, like I said, our closeout slides. Um, But if folks continue to have, if questions occur to you for Alex, please post those in the chat and we'll be sure to get to them or follow up via email. So we mentioned some research. We strongly encourage, I think you heard from both myself and Alex, that we need more data. And we have some initial research, but more is needed. If you're interested in that, there is a QR code here on the research AIDPH has done. We have research across our 4 communities of focus, including, but linking directly here to our queer inclusion and belonging resources. You can scan the QR code, or Shayla's popping them in the chat here. I also want to note, I think I'm going to see something occurred to me when we were talking about the legislative pieces. I suspect a fair amount of people on this call or watching asynchronously are involved in open. But if you want to get more activated around advocacy with oral health and are thinking through those legislative slides that Alex shared, open is a great place to start and get involved in the advocacy piece and addressing those legislative pieces that are coming up. We can pop that in the chat as well. I'm going to paste that in here as another resource. As we mentioned at the top of the call, CEU is available for those who participated in the full session here today. If you were late to the call and were unable to participate fully, you can watch the recording asynchronously and get your CEU that way as well. Shayla is posting the link to our Academy in the chat for the CEU to fill out your evaluation and your CEU request. If you do not need a CEU for this session, we still encourage you to complete the evaluation. We love hearing from our participants. We are always reviewing feedback and upgrading our programs accordingly, particularly at this time of year when we are looking ahead and planning our next year's programming. Again, all of our resources and materials will be posted here today. Keep an eye out for that. Again, strongly encourage you a step forward on the information that we heard today is amplifying the need. So that would be taking a step like sharing out the recording with colleagues, with your coalition, thinking through how you can amplify the work. Sharing out the recording and passing it along is a way to do that. Okay, and stay tuned for the next Rooted seminar in 2026. This is just a little more detail on our CEU instructions. When you land in the Academy, when you follow that link that Shayla shared, if you have not joined our Academy space previously, you may need to set up your username and password. You then have full access to past Rooted seminars, to watch asynchronously, to look at those certificate programs. So when you land on that CEU link, don't click continue, but scroll to the bottom of the page. You'll be able to review previous seminars. You scroll down to December and follow the prompts for the CEU request. So just kind of noting it won't be right at the top. You scroll down and find the information below. Okay, we are right at time. I'm going to pause. Did any questions pop up in the chat? Okay.
Liz, some questions did pop up. It looks like Alex has already addressed
Okay.
those and he's going to connect directly. But I also just wanted to let everyone know I will be sending a follow-up email out and I'm going to connect with Alex as well to get those answered. So all of those questions will be answered in the follow-up email as well.
Okay, perfect. Yeah, I see some clinical questions. Fantastic. Okay, great. Well, again, thank you everyone for joining us here today. We appreciate your time. And I hope everyone had a wonderful session. We will see you back on another Rooted seminar in 2026. And in the meantime, I hope everyone has a wonderful holiday season. Take care, all.